Joachim Choge is a man of many titles. Lead sonographer and radiographer at Jionee are among his favorites. He is mainly known for offering mobile ultrasound services from the comfort of his patient's home. He started Jionee Ultrasound Mobile Services in Nairobi, Eastlands, in August 2018 and has seen his business flourish, especially during the onset of the COVID-19 period. So what inspired him to start the mobile clinic?
I'm Joachim Choge, a practicing radiographer and a sonographer. I practice currently private, but before I worked in St. Mary's Mission Hospital in Gilgil. I worked in Nanyuki Medical Diagnostic Center in Nanyuki. And later I worked in Thika Road Health Services, a gynecology center, which I worked for 1 year, then I resigned. After resignation, I did a freelancing, I did freelancing for 6 months, whereby I was going on locum basis to facilities with equipments. And during that journey of six months of working on locum basis, I realized there are many facilities which don't have the equipments as well as the human resource. So I opted to come up with a Jionee, which we started by getting 1 unit, and then thereafter I now began marketing to clinics, regardless of the size of the clinic, for us to offer the service. They were so reluctant to accept the service, but finally, after a journey of almost 1 year, they now began to embrace that actually an ultrasound can be done in my clinic. Whether I have the machine or I don't have, the service can still be provided in my center. So we started like that. We went to small clinics one by one. We started with 1, then 2, 3, 4. Up to now, we have several of them on the board. And during the journey of providing service to clinics, there were patients that they had some complications, and we had no choice but to go and offer the service from home. And now the concept of mobile now came in and became the real thing for us. And we focus and we realize that there are services that are really needed from home for different people.
Sonographers and radiographers are medical professionals who are especially trained to conduct diagnostic medical imaging using variety of equipment. The 4 main mobile services offered at Jionee Ultrasound Mobile Services include echocardiograms, electrocardiograms, ultrasounds and X-rays. While it might look as easy as loading a machine onto a vehicle and driving to the patient's location, it takes time and especially money to set up such a business.
To be honest, this business is not cheap. It is not something that you wake up from the blues and do it. I call it an evolution that is coming as a result of persistence. It's very expensive to set up. Just to set up one mobile service provision. And when I say mobile, I mean a unit, a car, and a qualified profession, and a qualified driver. So those are 4 components together. Setting up that 1 unit alone can cost up to 3 million. Then also, despite that, running cost also is very high. But we do it because we are looking at what we want to offer to the patient. Access, affordable, and less risk.
Things were slow in the initial days of his business, but his big break came during the COVID-19 pandemic because many people did not want to go to hospital.
We found the first customer in 2019 March, and we started in August 2018. we didn't really look for that client, but it's the client who looked for us. And now it opened our minds that, oh, so we can offer this service at home. And now we began to advertise. And from there, that's the number was quite low, then going up. And then the COVID thing came in. Most of the clients get to know us because they didn't want to go to the hospital. So we do one patient, they refer a friend. Then they began liking our Facebook page and Instagram. And now that is what has brought us up to where we are.
Jionee's main selling point is the cost of their services. For instance, in hospitals like Aga Khan, MP Shah, Avenue Hospitals and Upper Hill Radiology Center, a normal obstetrics ultrasound ranges between 5,900 shillings to 6,950 shillings. An X-ray costs between 1,800 shillings to 3,500 shillings. An echo can go up to 19,015. However, the cost in a public hospital like Kenyatta National Hospital, an echo is 4,500 shillings, while an ECG will go for as low as 750 shillings.
Our pricing is favorable to everyone. You can get a normal obstetric ultrasound that is majorly for pregnancy at 1,800 across Nairobi. We have no selection, we have no choice anywhere across Nairobi, including Thika, Kiambu, and those parts of Kajiado, that is Ngong, Rongai, and Kitengela. For the X-rays at home, we charge 2,500 across Nairobi. The charges are inclusive of the service and the reporting from the specialized radiologist. So quality is guaranteed. For ECG across Nairobi, we do at 1,800. For echocardiogram at ECG as a package, we do across Nairobi at 8,000 Kenya shillings.
Other than offering house services, his bulk customers come from other service providers like private hospitals and health specialists who outsource his services at subsidized costs.
We have really helped them not to invest in equipment and labor, but they just have their patient there and then they call us, we co-deliver the service, provide the results and come back. We offer to many facilities, approximately around 250 in Nairobi at the moment.
And just like any other business, he has his own share of challenges.
Traffic is a nightmare to us. Like, you have a patient, either she is bleeding or we are querying heart failure, she has difficulty in breathing, he or she needs a chest x-ray, echo and ultrasound together. And then you are going to that patient and then you find a huge heavy traffic. Another challenging part of this job is running maintenance costs, because you have to always do the service for the cars, you have to service the equipment, you have to always get the right sonographer all the time to cover the service. So that is majorly the bigger part. And then the worst is when one of the cars gets a breakdown, or two at once. That's a trouble, because you have to take for repairs at the same time you have to deliver the service. When you think of outsourcing, it's very expensive, as per our charges are also so low.
Despite these challenges, he is hopeful that in the near future, the world will embrace healthcare delivery systems that are not conventional and improve service delivery to people at their comfort.
As far as this business is concerned, I'm looking into a world of healthcare whereby all the services can be provided to you from home, whether it's delivery, whether it's a cesarean. I'm looking forward to that ideal environment whereby if mobile theater can be done, I would do it. If that is possible and if the Kenyan law would allow, so that everyone can get the service from their home. So that is what I'm looking into, and making it further, let it grow all parts of this country, and if possible even regionally.